Assalamu alaikum, everyone. Welcome back to another episode of the Medical Talk. Today, we have a very special guest with us, Dr. David Gaines. Dr. David is a urologist and a robotic surgeon and is also an entrepreneur. That is a very interesting thing about him. And he is the founder of WellPrept, a platform for patient education and that makes healthcare practice easier for doctors. And we'll talk about that in detail in this interview. So I'm very honored to have him here today with us. Thank you so much for joining.
Thank you so much for inviting me. Really, I'm the one who's honored.
Thank you. We usually start by talking a bit about early life. Where were you born and raised, and what was your early education like, and how did it pave your way towards medicine?
So I was born in Johannesburg, South Africa, and shortly after I was born, we moved to Toronto, Canada. My mother was a language teacher. My father was an actuary. No doctors in the family, and we moved to New York when I was in second grade at age 7. And pretty much I grew up in that area in the United States for the rest of my life. I knew I wanted to be a doctor from a very early age. I just remember being fascinated by the actual doctor visit. Even as young as 5, 6 years old, going to the doctor seemed like a sort of a magical moment. This might be an odd thing for a child to think when they're going to the doctor, but I remember thinking, I wonder how this doctor knows everything that could possibly go wrong with the human body.
Yeah.
So in the back of my mind, there was always a possibility of, something that I personally wanted to pursue. And then I ended up loving the sciences, and that I arrived at medicine in a similar fashion to a lot of other people.
So that's very fascinating. Most of the kids, when they go to the doctor, they're either scared or they just want to run away, but you had it and you were fascinated by it. So I think that's amazing.
Yeah, in fact, I remember thinking, I think I had something simple like a sore throat, but the doctor was asking me all these questions. Do you have a headache? Does it hurt when you swallow? And I remember thinking, I better think carefully about the answer that I'm giving, because if I give the wrong answer, the doctor's going to think I have something else. So, yeah, I mean, that it is a kind of an odd thing for a kid to think.
Yeah, that's a very smart thing for a kid to think as well. What got you interested into urology as a specialty?
Yeah, the journey to urology, I'm not sure if it's similar in Pakistan, but in the United States, very early on in medical training, you start with dissecting a cadaver and you're thrust into gross anatomy. And in my class, that was a very polarizing event. So some people hated it and some people loved it. And generally speaking, this is somewhat of a stereotype, but generally speaking, the people who loved it gravitated towards surgical fields, and people who could do without it, medical fields, with exceptions. But I knew from the first couple weeks as a medical student that I loved using my hands, I loved gross anatomy, and that I wanted to do something surgical. And then at that point, it really became a question of who were the influential mentors that I happened to come across. And I really think my interest in urology was somewhat fortuitous. It was kind of happenstance. And so I met some mentors who were very influential in urology, very nice people. And, I just kind of wanted to be like them. And I fell in love with urology. The other thing about urology is, we get to form relationships with our patients. The surgical issues that we fix frequently have a happy outcome. Yeah. Person starts with a problem, and we're usually able to fix it. So it's very satisfying in that way.
It's a very interesting specialty, as you mentioned, that there is a very good doctor-patient relationship. Some specialties lack it a bit, but I think that's very important, a good relationship between the doctor and the patient. Moving on from urology, how did you get interested into patient education, and then moving on to WellPrept, and how did you come up with that idea? Because it's a very unique idea. This is the first time I'm hearing something like this.
Yeah, so the patient education piece, I have to say, I think most doctors consider themselves to be teachers in some way.
Yeah.
I think it doesn't matter what field you're in. We do so much teaching as the in the process of healing a patient.
Mm.
Such a significant portion of that is teaching. So I think many, in that way, I'm like others, I think, where I enjoy teaching, but you know, teaching's always been part of who I am. Even in high school, I was a peer tutor, and in medical school, I was a peer tutor. I've always enjoyed trying to figure out a good way of explaining complex topics to people. I enjoy it, and it sort of comes naturally to me. What my style as a doctor, even early on, before I thought of WellPrept,
Yeah.
was very teaching oriented. I have whiteboards in my exam room, frequently drawing on the dry erase board, and educating the patients. I really enjoy it. The WellPrep concept didn't hit me over the head, but I'll tell you how that came to be. The the thing that started to bother me, I would say, mid-career. I was about 8 years out of fellowship, and in a busy practice, a practice exactly the way I wanted my practice to be. I found myself um, frustrated with the repetitive explanations that I had to give to patients, and we all do it.
Yeah.
So, as much as I love teaching, I had figured out how I like to explain the top 50 or 60 things that I have to explain as a urologist, but it became a little bit um, repetitive and mindless. Those moments where I was explaining things, I remember one in particular that always resonates with me. I was discussing a new prostate cancer diagnosis with a 68-year-old engineer, and he's a very smart patient with a lot of great questions, very inquisitive. And when we talk about prostate cancer, the first thing we have to explain is Gleason scoring and grading versus staging of cancer.
Yeah.
And I had given this explanation so many times. I entered into this, autopilot mode. I gave my speech, and I felt very disconnected.
Yeah.
Um, it's sort of like, when you're driving on a commute and you've done it so many times, you arrive at your destination, you don't remember driving. It's not a good feeling when you, at least for me, it bothered me a lot because I like connecting with people. I like talking to people. And when you enter into any repetitive
Yeah.
mode, you're no longer fully present with the person in front of you. So I started sending a PDF of a prostate cancer guide to the patients before they showed up.
Mm.
And I took it one step further, and I recorded a couple of short videos of my explanations for the most common procedure I do, which is robotic prostate removal. And I was nervous. I thought, if I send patients to a video, are they going to be upset that that I don't want to explain it to them in person? And that never happened. And actually, it opened up space in the visit for me to explain more advanced concepts to them. And it started like really improving. I wasn't thinking about starting a company at this point. I was just trying to help my own practice. And it was a small change, and it was really quite helpful.
Yeah.
So then came along, I don't know if you've seen on social media, on Instagram, when people have a link in their bio on Instagram, they can use things like Linktree. Have you seen that before?
Yes. Yes.
Yeah. So these link aggregators became very popular, and they're very simple websites with a bunch of buttons, and you can put whatever content you want. When I saw that, I thought, boy, this would be a really easy way for me to organize my educational content to send to patients, because it was getting a little bit onerous for my secretary to send all these things, because I went from prostate cancer to kidney stones to kidney cancer, and I started building up all this material. And so I made a prototype, and this is when I did what they say entrepreneurs should do, which is test the theory. So
Yeah.
I created some prototypes for about 10 urologists that are in my inner circle. These very organized educational pages with content to explain the top urologic conditions. And they started using it and they loved it. And a few people, it's really hard to change a doctor's workflow.
Yeah.
So when I saw that doctors were really kind of excited about this and it was changing their practice, a few of them printed their business cards with the QR code right on it. And so at that point, I thought, all right, this seems like it really could help a lot of doctors, and patients love it too. So I've got to actually spread this as far as I can. And then I, decided to start a company.
The thing you talked about being on an autopilot mode, it gets very frustrating at times when you want to have a connection with the other person, but then you're doing it every single day. So obviously your brain is wired that way, that you just go on about it, and you just get lost when you're talking about certain things. This term called cyberchondria, I believe, where a patient reads up stuff online and then they have all of these different notions of the kind of disease they have and they self-diagnose themselves. So I think WellPrept is going to counter that as well.
Cyberchondria, I love that term. I haven't heard that term before, but it's perfect. Yeah, I mean, you have several problems on the patient side. One is what you bring up, which is that patients can look at information and get overwhelmed or scared. And the other piece is, if we rewind 20 years, there wasn't much educational content online. Now we have too much.
Yeah.
And it's not vetted. No one knows what's good, what's bad, and just because it ranks highly, say a video ranks highly on YouTube, doesn't mean that it's reliable. Yeah. So I think you're right. In this case, the doctor gets to decide completely what goes on their WellPrept pages. So that adds a layer of a filter or an additional sort of check mark that says, I've reviewed this stuff, I vouch for it all. And it takes the pressure off the patient. They don't have to Google it. Yeah. And I think that's, a little piece of stress relief on the patient side.
A lot of people say in Pakistan, I mean, it's very difficult to filter out the information for someone who does not know medicine. So they say that even if you have a headache and you Google it, Google will tell you that you have a tumor in your a brain tumor or something. And even if you do have it, or if you don't, it's very stressful for the patient because they don't understand the medical language. It's very difficult for them. So it's very good that a doctor can filter the kind of information so that they can have a better conversation with the patient when the patient comes to them.
That's exactly right. The conversation, the whole idea here is not to avoid conversation with the patient. It's actually to make it better. And what some of the early WellPrept users have told me is that the visits with new patients feel like return visits because there's some foundational knowledge that has already been transferred. And if you think about it, I've heard patients tell me, very well educated patients who understand when they're sitting in front of the doctor and this basic foundational information is being transferred, they recognize that it's basic, but still you can't get to the part that is, okay, now here's what we're going to do for you. Yeah. You can't get to that part without going through a few steps. So if you can offload those steps to happen before the visit, we can move past this concept that the visit starts when the person shows up, face to face. In my opinion, the doctor's visit can start sort of virtually long before that. And we can stop thinking about the doctor's visit as this time that is only when the doctor and the patient are face to face.
That's amazing. What is the kind of feedback you have received from other doctors apart from urologists? And have you faced any reluctance from doctors when you introduced the concept of WellPrept?
Yeah, I have faced, it's interesting. It depends on who I talk to. What I'm discovering is that some people just immediately get it. Doctors I'm talking about. and the conversation goes something like this. And it doesn't matter what field. It can be urology, it can be cardiology, nephrology, even internal medicine, anything. If I say to a doctor and I'm introducing the WellPrep concept, what are the 3 or 4 things that you explain over and over and over and over again without hesitating? Most doctors can immediately come up with a list. Or if I say, you know, if you could maybe not explain something again, what would that be? And they say, oh, I wish I didn't have to explain blah, blah, blah. They've got some answer. Those doctors who have been maybe aware of this to some degree, that it was a problem for them, but maybe hadn't quite articulated it. When they see WellPrept, they immediately say, oh, yeah, I get it. When can I try it? There are some other doctors where they sort of don't get it right away and sort of say, well, is it a website? I'm not sure I need a website. And in some conversations, the person just is not receptive to it. Here's what I would say. I sort of have changed my approach in that there's so many doctors who get it. I've sort of stopped twisting the arms of people who don't get it, because there's just too many people knocking on the door to try it who get it immediately.
I feel like as we progress towards the future and everything is becoming virtual, interviews are virtual, conversations are virtual, and telemedicine is emerging as well. So I think eventually all of the doctors will understand the point of view and understand the concept of WellPrept and other platforms that are helping patients virtually before they're coming to the doctor.
Yeah, the other thing is there've been a couple of fallouts from COVID.
Yeah.
That when it comes to technology, that have made, for example, Zoom. You and I are talking on Zoom right now. That used to seem very unusual, and now it seems incredibly commonplace. The concept of a QR code, even my 86-year-old patients whip out their phone and scan a QR code. I mean, and we all wish COVID never happened, but we can thank COVID for normalizing those two technologies. So if I tell a doctor who's interested in WellPrept, listen, start a Zoom conference with just yourself, make a PowerPoint for explaining atrial fibrillation, and record the Zoom conference for 7 minutes with your explanation. We're going to put that on YouTube and put it on your WellPrep page. Doctors get that. Like, that doesn't sound too crazy to people. If I explained that to someone in 2014, they would have said, what? Zoom? So some of this is just feels like right place at the right time for those reasons. And also because doctors are feeling very overwhelmed right now. And if what the early users are saying is that this is feels like a bit of relief to offload these repetitive explanations. You're really outsourcing it to yourself in a way.
Do you plan on expanding this to countries like Pakistan?
We actually can support international users already. There's a few tweaks that we need to make, but I already have users in South Africa and Dublin, Ireland, and the UK and Australia and China. And so, yes, if there are some users in Pakistan who want to get started with it, we can actually already do that. It's the most robust. It's built out in the most robust way for urology, because when a new user in urology signs on, it already gives suggested content in urology. We don't have suggested content yet in other specialties. We're working hard on it. But for example, I already have users who are non-urologists, not in the US, they have to be willing to put in a little bit more work to source their own content. But you know, the thing that gets me so excited about this is the reaction, the emails and the personal messages that I get from doctors who, when they see this, they say, "Oh my God, I didn't quite know that this is exactly what I needed, but now that I see it, I know that I could use it." And so, yeah, I would love to hear from doctors in Pakistan who resonate with the idea and want to try it out.
It's a great concept, and we haven't really heard of something like this before. It's the same thing that you mentioned, that you don't really know that you need it until you use it, or you
Yeah.
understand it, or you hear about it. Yeah.
And if you think about non-medical industries
Yeah.
that have to answer the similar questions over and over again, doctors are really the only people who, I'm not sure if it's out of a sense of guilt or obligation,
Yeah.
are willing to organically do it from scratch every single time. Um, Other industries will create a knowledge base, right? They'll say, go to our help center and go through this knowledge base document. And if you still have questions, let me know. And that may sound a little bit cold in the medical realm, and we're not really creating a help center. But in a way, what you're doing is the doctor says, okay, for I'm just pulling out a random disease condition in nephrology. For CKD, this is my favorite bunch of information. I like I like these PDFs, I like these videos. This is a great podcast on CKD. Here's my favorite stuff. I want you to consume all this material, and then we can have a more interesting, advanced conversation that is specific about you. Um, and so I think young doctors kind of get this immediately. May, I'm still figuring out if it's a generational thing as far as who kind of understands. I think we have to break down some barriers of people. Like one of the you asked me what objections I get. Another objection is I think the patient wants to hear it from me.
Yeah.
Okay. And that is and I thought that too, actually. I thought maybe the patient wants to hear, and what I'm finding and what I'm hearing from other users is they do want to hear from you. It doesn't have to be everything from a blank slate all the way up to advanced concepts. Let them consume the basic stuff and let them hear the more advanced stuff from you. They still definitely want to hear from you. But there's another layer to this, Anusha, which is that is everybody masked in Pakistan when you see patients still because of COVID? Everyone's wearing masks.
Depends.
It
Not
depends.
all of them. Yeah.
In the U.S., we're all still masked,
Yeah.
and having even a simple video on a phone, low tech, where the patients can see your face unmasked, it, I think helps with the patient developing a relationship with you.
That's a very good point for sure, because when you wear a mask, your expressions kind of get hidden behind that. So it's good that you can actually have even if it's a virtual interaction with the patient. And it's like the flipped classroom method, if you think about it, where the teacher sends some material before the class, where they just have a basic understanding, so that when they come to the class, they can have a more intellectual discussion. They can understand, they can ask questions about the things they don't understand. And it's a better way to learn, I believe.
This is exactly a flipped classroom model. That's exactly what it is.
When you started this, obviously you are a physician and you have a very busy schedule. How is the work-life balance like for you when you're a physician as well and an entrepreneur? And what is your advice to medical students? Because in Pakistan and all over the world, there are a lot of medical students who are entrepreneurs alongside doing their medical degrees. So what is your advice to those students?
All right. So the honest answer is I'm personally still working on this myself. It is very, very difficult. So far, this is one of the most challenging aspects of balancing entrepreneurship with a busy clinical practice. So I have a lot of thoughts on the on the topic. One is, um, before you jump in, you have to be totally passionate about whatever the journey is that you're about to embark on. It cannot be, I've had a couple of friends say, "Oh, this sounds like a great idea. Maybe this is going to be a source of passive income." And I always laugh to myself when I hear someone say that. There is nothing passive. Uh, if it ever generates some income, that's one thing, but there's nothing passive about this at all. It's the most active pursuit. In fact, I don't really think there's such thing as passive income. That's a whole separate topic, but it is so active. There has to be real, genuine passion around that drives you towards this goal. Otherwise, you will burn out. I'm getting less sleep than I should be getting. Every minute of my day is accounted for. So I'm I'm very careful to not work on this during work hours, which means early mornings and evenings become full, and so I couldn't do this unless it was unless it felt really like a strong purpose. And that is what it feels like. Um, and you also have to be willing to enjoy it even if it fails, so regardless of the outcome, because the statistics are somewhat dismal, and so you really need to be, it has to feel like fun.
Yeah.
um, I know I talked about a lot of concepts there, but the work-life balance is incredibly challenging. um, but I wouldn't be able to do it unless it felt like fun and like a real mission. And so if I had to figure out early on what really lights me up about this. And I mentioned it before. I'm getting messages from doctors daily by email who are trying it out, and they're saying thank you, and my clinics are a little bit easier, and I'm enjoying interacting with patients more. And that is so satisfying. I mean, I love helping patients. I didn't realize how much I was going to love helping doctors, and even doctors that I would otherwise never have met. Um, it is so intensely satisfying that I'll take a few hours less sleep and all that other kind of stuff. But if I wasn't sure about the concept I was pursuing, or not that passionate about it, or it wasn't that interesting, I would not be able to do it. Anytime you see any entrepreneurial effort, it's the tip of the iceberg, and you're not seeing all the things that go into it, and the failures and the uncertainty. Um, we could talk a lot about failures. I've only been at this about a year, and it's a series of experiments, and a lot of them go nowhere, and you have great hypotheses and they fall flat, and then you've got to start over. And yeah, but it's fun. It's incredible. It is so much fun. If it's not fun, it won't work out, because you won't maintain the drive to keep pushing at it.
So, Dr. Keynes, where do you see WellPrep 10 years from now?
I do envision where WellPrept will get really powerful is when it functions as a community, and doctors can source and see the best content used successfully by their peers in the same specialty. So in that way, it can sort of become like an engine where the platform itself surfaces the most effective, engaging content, because of its reach. So that's somewhat aspirational, but I think we can achieve that for sure.
I think it's going to be great in the next 10 years. I believe it's just been 1 year since you've launched the platform, right?
Yeah, I mean, a year and a half ago, it was just an idea.
Yeah.
We're right now, I would say we're sort of pre-launch, because we've just been pulling people off of a wait list, so we haven't actually fully launched yet. But so yeah, I mean, I would sort of say we're in a like an alpha stage.
So, do you have any advice for medical students who are just starting off their medical careers?
Yeah. So a couple things. One is I think that as medical students tend to obsess about what specialty they're going to choose, and of course that's a very important question. But one of the things I tell medical students is there's probably five, six, seven specialties that you would be happy in. It's not just one. And I think once you kind of take that broader perspective, that there might be several right answers, that there's not only just one. Now that I graduated from medical school 21 years ago, I can say confidently I would have been happy in several different surgical subspecialties. I would have been happy as a radiologist. I would have been happy as an anesthesiologist. I would have been happy as an interventional radiologist. There's probably actually 10 specialties that I would have been just fine. It's not just urology. And so that's one thing. It takes the pressure off of like wondering if you found the only one answer for yourself. The second thing that I would tell medical students is we're a very driven breed. Like, we work hard in school to get to medical school, and we work really hard in medical school to get to the specialty that we want. And we're always driving towards this goal. The one thing that I didn't think about is what is it going to be like as a mid-career or late career doctor? And I don't want this to come off as pessimistic, but there are some aspects of mid and late career work that gets a little bit less challenging and a little bit less interesting. I don't want that to come off in the wrong way, but you figure out the algorithms and the decision making, and the decision making becomes less challenging. You need to figure out what is going to maintain your spark mid and late career, and that's different for everybody. For some people that's research, for some people it's teaching trainees, for others it's getting involved in administrative work in their practice or in the hospital. But that's one of the reasons why people engage in these activities, and it's very good to lay the groundwork for those things in your early career, because it's challenging to just suddenly turn those things on. For other people, it's going to be entrepreneurship. I stumbled on that somewhat reluctantly and figured out that it was a passion. But before that happened to me, teaching was what really made things new and interesting for me. So having a mind to that early on, I think, is useful.
That's great advice. I think that's very helpful for me as well, because I'm a second year medical student right now, and all we are concerned about, most of my class fellows, about what specialty we're going to go into. We have to decide in the near future, and it gets very overwhelming at times. But what you mentioned is really amazing.
Yeah, it's sort of a whatever specialty you're rotating through,
Yeah.
you suddenly want to do that,
Yeah.
but that's a good thing. Again, I think there's probably several different ones that would be just fine.
When you think about medicine 20 years from now, what do you envision it as? How do you see medicine and medical practice 20 years from now?
Yeah, that's a great question. One thing's for certain, whatever I say is probably going to be wrong because that's how predictions go. But have you used any of the artificial intelligence writing tools that have just come out? There's these artificial intelligence assisted writing applications now that are based on an open source AI engine called, I think it's called GPT-3, although I could be saying that wrong. I'm telling you this because I started using it, and it made me think of this has got to be what medicine is going to be like in 20 years. What you can do right now is, let's say you want to write a blog, you type the first sentence, and the AI engine suggests the next sentence.
Wow.
It's incredible to experience this. And this is like very early days of AI. I think we're going to look back on this and think, boy, that was silly. But when you actually try this and you can refresh it and you don't like that sentence, try a different one. You accept that sentence and then it gives you a suggestion for the third sentence. So similarly, I think that medical practice is going to be augmented by AI assistance. So my my hope is the things that I love about being a doctor are very similar now as they were 20 years ago. The face-to-face interaction with the patient, developing that bond,
Yeah.
and the procedure-based surgical things that we do. Those things haven't changed much, or really barely at all in the last 20 years from my perspective. And those are the most enjoyable parts of the job. So my hope is that AI will assist in all the things that surround core those core enjoyable, really important things that we do. Human beings, we're really good at making decisions if we're fed all the right data. So my hope is that the technology that surrounds us makes doing what we do so easy and enjoyable that the focus becomes, a very human. It's kind of ironic. The more tech you add in there, there's a danger of making it very impersonal. But I think it can actually leave space for just that human connection when everything else is assisting you, helping you make the right decisions, feeding you the best data. Hopefully, the electronic medical records become AI assisted to the point where it doesn't consume all of our time, and it leaving space for the important stuff. I think it's definitely a danger with technology. I don't know if you have the same situation, but sometimes when I'm rounding in the hospital, I look around and I see the nurses staring at a computer screen, and I see the residents and the medical students in front of the electronic medical record, and there is a real danger of it heading in the wrong direction. But that's why I think the best source of technical, health technology improvements are going to come from people who are actually practicing.
Yeah.
That's why my hope is that there's a listener right now who's got a great idea, who's going to be empowered to go pursue it. Because again, the people who are experiencing the clinical care in the front lines are in the best position to fix it. There's another example that just yesterday on Twitter, there was a discussion about a JAMA article that looked at over 1 million health records and looked at how much people are copy pasting old stuff and repeating it in the chart. Copy paste is a real problem and a real hazard. And they made actual suggestions for how the electronic medical record could eliminate those problems. For example, a lot of us copy and paste stuff because we want to review all the most important information. We want the most important information in front of us, and that, doesn't change. EHRs could be redesigned to keep serving you that information that you want to see, but doesn't have to go in the note. That's just a small example, but there are many ways in which we are shackled by technology right now in medicine. But I think that as we go together, we'll figure out a way to make it help us rather than hurt us.
I think if you use it with a little thoughtfulness, technology will really improve medicine. You just need to be more careful, as you mentioned.
Absolutely.
I think that brings us to the end of our conversation. Thank you so much for joining us. It was actually an honor having you here. I have been following WellPrep for the past few months, and it was really interesting for me, and it's an honor having a conversation with you about it. Thank you so much for joining. I hope that we can have you again on the podcast.
Thank you for having me. I appreciate it.